Hi and welcome. My name is Alicia, and today we talk about acne. Please stop using your acne treatments immediately now because I'm going to show you why your treatment doesn't work. So please listen because everything you think you know about acne is probably wrong. And I'm about to blow your mind with the truth that the skincare industry has been hiding from you for decades. You guys, I've been in the natural skincare world for over many years, and what I'm about to tell you is going to make you absolutely furious. There's a reason why 85% of people are still struggling with breakouts well into their 40s and 50s, and it's not because their skin is difficult or hormonal. It's because they've been lied to about what acne actually is. Just last month, I had a client, let's call her Janet, who came to me after spending $2,000 on dermatologist treatments that made her skin worse. She was using harsh chemicals, antibiotics that destroyed her gut health, and birth control that completely wrecked her hormones. Sound familiar? Here's the shocking truth. There are actually 6 different types of acne, and 90% of people are treating theirs completely wrong. They're using the same generic routine for blackheads that they use for cystic acne. And that's like trying to fix a broken bone with a Band-Aid. By the end of this video, you're going to know exactly which type of acne you have, why everything you've tried has failed, and the natural solution that's going to change your skin forever. Trust me on this. This is your skincare game changer. You guys, the skincare industry has been feeding us the biggest lie for decades. They want you to believe that all acne is the same. Just slap on some salicylic acid and call it a day. But here's what they're not telling you. There are 2 completely different categories of acne. And if you're treating them the same way, you're actually making your skin worse. I see this mistake every single day, and it breaks my heart because people are suffering unnecessarily. Let me tell you about another client, Jessica. She spent 2 years using benzoyl peroxide on what she thought was regular acne. But what she actually had was inflammatory acne buried deep in her skin layers. She was essentially putting a surface treatment on a deep tissue problem. No wonder her skin was angry, red, and getting worse by the month. The first category is non-inflammatory acne. These are your blackheads and whiteheads. They're not red, not painful, just sitting there in your pores like unwanted guests. The body hasn't even recognized them as a problem yet, which is why they're actually the easiest to treat naturally. But then there's inflammatory acne, and this is where it gets serious. We're talking about papules, pustules, nodules, and cystic acne. These bad boys are deep, they're painful, they're red and swollen, and they're your skin's way of screaming, "Help me." Here's the kicker. About 70% of people I meet are using inflammatory acne treatments on non-inflammatory acne, or vice versa. It's like trying to put out a grease fire with water. You're just making the problem explode. Okay, you guys, this is where it gets really interesting. I'm about to break down the 6 types of acne that your dermatologist probably never properly explained to you. And once you understand this, everything is going to click into place. Let's start with the easy ones. And I use that term loosely because even these can be stubborn if you're doing it wrong. Whiteheads. These little troublemakers are closed comedones. Think of them as clogged pores with a roof over them. They're sitting under your skin, just chillin', made up of dead skin cells, bacteria, and oil. The tragedy. Most people are trying to pop them or using harsh scrubs. Stop it. You're just pushing the infection deeper. Blackheads. Now these guys have their tops exposed to air, which is why they turn black. It's oxidation, not dirt. Here's what makes me absolutely furious. People are still using those pore strips. You guys, those strips are literally ripping off the top layer of your skin and telling your oil glands to go into overdrive. It's skincare sabotage. Now we get to the inflammatory types, and this is where people really mess up. Papules. These are when your clogged pore contents spill out into the surrounding skin. Red, inflamed, but no pus. People see the redness and think, I need to dry this out. Wrong. You need to calm the inflammation from the inside out. Pustules. The name gives it away, right? There's pus inside these inflamed bumps. They usually come in clusters on your face, chest, or back. And here's the controversial part. Your doctor probably wants to put you on antibiotics. But I'm going to tell you why that's potentially destroying your health. The final two are the serious players: nodular and cystic acne. These are deep, painful, and they don't mess around. Nodules feel like hard knots under your skin with no head. Cysts are softer with pus-filled sacs. Both are your skin's SOS signal that something is seriously imbalanced internally. You guys, I need to get real with you about the mistakes that are keeping you stuck in this acne nightmare. And some of these are going to make you absolutely mad at the advice you've been given. Mistake number 1. Using the same treatment for every type of acne. I had a client, let's call her Jane, who was using a 10% benzoyl peroxide cleanser because higher percentage must be better, right? She used it on her sensitive skin with minor whiteheads. After 3 months, her skin barrier was completely destroyed, and she developed painful cystic acne from the irritation. The stronger is better mentality is ruining people's skin. Mistake number 2, the antibiotic trap. Here's what your dermatologist isn't telling you. Antibiotics for acne can destroy your gut microbiome, which is responsible for 70% of your immune system. I've seen clients develop chronic digestive issues, yeast infections, and even worse, acne rebounds after stopping antibiotics. Your skin is trying to tell you something is wrong internally, and antibiotics are just putting a Band-Aid on a bullet wound. Mistake number 3, birth control for acne. Ladies, this one is huge. Yes, birth control might clear your skin temporarily, but it's masking the real hormonal imbalance. When you eventually come off it, and many women do in their 30s and 40s, your acne comes back with a vengeance. Plus, you've now got additional hormone disruption to deal with. Mistake number 4, attacking surface-level symptoms on deep cystic acne. I see people slathering benzoyl peroxide on nodules and cysts, wondering why nothing works. These types of acne are happening in the deeper layers of your skin. Topical treatments alone are like trying to water a plant by spraying the leaves while the roots are dying. And here's the mistake that breaks my heart the most. People giving up and accepting that they'll always have acne. You guys, acne at any age is your body's way of communicating an imbalance. It's not a life sentence, it's a message. All right, this is where everything changes. I'm about to give you the natural, holistic approach that actually works. Because it treats the root cause, not just the symptoms. First, let's talk about the gentle yet effective topical treatments that won't destroy your skin barrier. For whiteheads and blackheads, you want to focus on gentle chemical exfoliation. Salicylic acid at 2% maximum. This dissolves the cement-holding dead skin cells together without stripping your skin. The key is consistency, not intensity. Here's a game changer most people don't know about: adapalene. It's used to be prescription only, but now it's available over the counter. It's comparable to low-strength tretinoin, but less irritating. If you could only choose one active ingredient for acne, this would be it. It works on multiple types of acne and actually helps prevent future breakouts. But here's where my approach gets revolutionary. For inflammatory acne, especially nodules and cysts, topical treatments are only half the equation. You must heal from the inside out. Let me tell you about David, a 42-year-old client who had severe cystic acne. He'd tried everything topically with minimal results. We focused on 3 internal factors: sleep optimization, your skin heals best at night. Staying up late spikes stress hormones that increase oil production. Proper hydration, most people are chronically dehydrated, which leads to constipation and toxic buildup that shows up on your face. And increasing blood circulation through gentle exercise and facial massage. Within 8 weeks, his cystic acne was 80% improved. Why? Because we addressed the stagnant blood flow and inflammation from the root level. For severe cases, I also recommend natural anti-inflammatory protocols. Omega-3, fatty acids, zinc supplementation, and adaptogenic herbs to balance stress hormones. Your skin is your largest organ, and it reflects what's happening inside your body. The secret sauce. Combining the right topical treatment for your specific acne type with internal healing protocols. This is what the skincare industry doesn't want you to know, because they make more money selling you endless products than actually solving your problem. You guys, knowledge without action is useless. So let me give you the exact step-by-step plan to implement this starting today. Step 1. Identify your acne type. Look in the mirror right now. Are your breakouts mostly closed bumps under the skin, whiteheads, or open pores with dark centers called blackheads? These are non-inflammatory and respond well to gentle salicylic acid treatments. Or are you dealing with red, inflamed bumps with or without pus, papules, and pustules? Maybe deep, painful nodules or soft cysts. These require the combined internal-external approach I just described. Step 2. Start your gentle evening routine. Cleanse with a gentle, pH-balanced cleanser. Not a harsh acne wash that strips your skin. Apply your treatment, adapalene for most people, or 2% salicylic acid for non-inflammatory types. Follow with a lightweight, non-comedogenic moisturizer. Yes, even oily skin needs moisture. Step 3. Morning Protection Protocol. Gentle cleanse. Apply a vitamin C serum for antioxidant protection and to help with any dark spots from previous breakouts. Always finish with broad-spectrum SPF 30+ sunscreen. This is non-negotiable. Acne treatments can make your skin more sensitive to sun damage. Step 4. Internal healing. And this is crucial for inflammatory acne. Prioritize 7 to 9 hours of sleep. Set a consistent bedtime and stick to it. Drink half your body weight in ounces of water daily. If you weigh 150 pounds, that's 75 ounces of water. Add gentle movement. Even a 20-minute walk increases blood circulation and helps with lymphatic drainage. Step 5. The patient's protocol. Here's what nobody tells you. Skin cell turnover takes 28 days, minimum. Give any new routine at least 6 to 8 weeks before making changes. I know it's frustrating, but consistency beats intensity every single time. Remember Janet from earlier? She followed this exact protocol, and after 3 months, her skin was completely transformed. She went from painful cystic breakouts to clear, glowing skin, and she's maintained it for over 2 years now. You guys, I want you to imagine something with me for a moment. Picture yourself 3 months from now, waking up, looking in the mirror, and actually loving what you see. No more covering your face with makeup. No more canceling plans because of a breakout. No more feeling like your skin is holding you back from living your best life. This isn't just a fantasy. This is your future when you implement what I've shared with you today. But here's the thing. It requires you to stop doing what everyone else is doing. Start doing what actually works. I've seen thousands of people transform their skin using these principles. Like Jennifer, who cleared her adult acne at 45 after struggling for over a decade. Or Marcus, who finally got rid of his back acne that had plagued him since his teens. These aren't special people with special skin. They just finally got the right information and took consistent action. Your skin is not broken. You are not destined to have acne forever. You just needed someone to tell you the truth about what's really going on and give you the roadmap to fix it naturally. The beauty industry wants you to believe that clear skin is complicated, expensive, and requires harsh treatments. But the truth is, when you work with your body instead of against it, healing happens naturally. So here's my challenge to you. Stop believing the lies. Stop using treatments that don't match your acne type. And start treating your skin and your body with the respect and care it deserves. Your clear skin journey starts right now. Don't wait for Monday. Don't wait for the perfect time. Start today. 'Cause you guys, you deserve to feel confident in your own skin, and I'm here to help you make that happen. Trust me on this. Your future self is going to thank you for taking action today. Now go get that glowing skin you've always dreamed of. Thank you for watching my video, and if you like it, please like and subscribe. Comments are welcome.